Hello?
Hello, this is Andy Russell with Rare Disease Legislative Advocate, and welcome to our September legislative meeting. We got a very packed agenda today with some great information on some very, very important bills for the rare disease community. If you take a look at our agenda, right here, we'll start with Andy Taylor from the Office of Representative Michael McCall, who will be presenting on the Childhood Cancer STAR Act. After that, we'll have Stephanie Krenrich from the Cystic Fibrosis Foundation talking about the Ensuring Access to Clinical Trials Act. Then we'll have John Knapp from the Children's Hospital Association giving us an update on the ACE Kids Act of 2015. That'll be followed by Annie Kennedy from PPMD, who will be giving an update on the patient-focused impact assessment legislation. And then we'll have Michael Ilions from the Pediatric Hydrocephalus Foundation giving an update about the Advancing Research for Hydrocephalus Act of 2015. He'll be followed by the Every Life Foundation's Executive Director, Julia Jenkins, who will be talking about our #Cures 2015 Day of Action. And then all followed up with some RDLA updates about our Senate briefing coming on next month, our Rare Voice Awards, and a wrap-up about our in-district lobby days. So if you have any questions whatsoever during the meeting, feel free to use the chat function from the WebEx, and I can relay those questions directly to the speakers and have them answered on the call. We will be recording this webinar, and it'll be available on rareadvocates.com or .org and under monthly meetings. So right now we're going to start. Andy Taylor from the Office of Rep. McCall. Are you on the line?
I am. Thank you for hosting me, Andy.
Great. Thank you so much for calling in and talking about this important bill.
Well, thank you, and I want to thank RDLA for hosting the call. For those who do not know, September is Childhood Cancer Awareness Month, and so we are making a big push in Congressman McCall's office to build support for the Childhood Cancer STAR Act. STAR stands for Survivorship, Treatment, Access, and Research. We're very excited about this bill, which we just introduced a couple of months ago with very strong bipartisan support in both the House and the Senate. My boss, Congressman McCall, is a co-chair of the Childhood Cancer Caucus, and he was joined in introducing this bill by his fellow co-chair, Congressman Chris Van Hollen from Maryland, and also Jackie Spear from California. Andy, do you want me to let you know when we want to go to the next slide? You're on mute.
Sure.
So,
yeah.
Okay. Unfortunately, I can't see the slides in front of me, so if you want to go to the next slide, I want to talk a little bit about the problem that we're trying to address and how our legislation addresses it. So just to start off talking about the issue, pediatric cancer, for those of you who don't know, is the leading disease killer of American children. And my boss and Congressman Van Hollen are co-chairs of the Childhood Cancer Caucus, in part to raise awareness about the issue of pediatric cancer and to address the unique needs facing pediatric cancer patients, their families, and survivors, but also to try to identify opportunities to improve our regulatory process, to enhance research, and to pass good bills into law. So there are over 15,000 children diagnosed each year with pediatric cancer. The survivor rate is getting much better. There was a time in the 60s, when pediatric cancer of all kinds was really a death sentence, and today the survivorship rate is improving. But part of the problem is that survivors themselves deal with long-term, very serious side effects as a result of their cancers, including secondary cancers, among many other challenges. So we think that by 2020, there'll be about 500,000 survivors out there, and there really aren't enough age-appropriate drugs for kids with cancer, and this is one of the reasons why survivors face so many issues. It's often not just from the cancer itself, but it's even from their treatment. If you want to go to the next slide. So To address the issue of pediatric cancer, we worked with folks in the pediatric cancer community on a bill that we really believe is truly advocacy-driven. The advocates themselves put this bill together. We feel fortunate enough to be the messengers and the sponsors of this bill, but this really is a bill that is the product of the work of those in the community. We put together a comprehensive bill that seeks to address a number of issues facing pediatric cancer patients, survivors, and their families. And so I'm going to talk about a few of the highlights of the legislation. First and foremost, our bill authorizes the National Cancer Institute to develop comprehensive children's cancer biorepositories. And this is a biorepository would enable us to collect physical tumor specimens for the purposes of long-term future longitudinal research. This is extremely important. The biorepository would be part of a national network. Doctors from around the country would be able to tap into this biorepository, and hopefully this could lead to some very groundbreaking research across the country. Our bill also would reauthorize and make improvements to the state-based childhood cancer registries that were already authorized in law a few years ago. We also ensure, as part of our bill, that there is pediatric expertise at the National Cancer Institute and also on the National Cancer Advisory Board. So we're very fortunate that just a few months ago, the chairman of the Children's Oncology Group, a guy named Dr. Peter Adamson, was appointed to be on the National Cancer Advisory Board. We're very happy about that, but our bill would make sure that in the future, there is a dedicated spot on the National Cancer Advisory Board for pediatric oncologists. We really believe that pediatric cancer is unique in cancer, and we should have the expertise appropriately represented on the National Cancer Advisory Board. Additionally, the Childhood Cancer STAR Act would also improve the FDA's compassionate use process by giving patients more access to information about that process. One of the big challenges facing pediatric cancer patients, as I mentioned earlier, is that there are not many age-appropriate drugs for children. There are a lot of drugs that have been developed for adults, and they are given to children with some changes in dosage, but often those treatments can be very harsh on kids with cancer. In some cases, there are no treatments available at all for certain kinds of ultra-rare pediatric cancers. And so what ends up happening is that a lot of children try to get access to the clinical trial process, but when there's no clinical trial open or available to patients, their only other option is often to seek access to a drug that is experimental and outside of the clinical trial setting, and that's the compassionate use process. Right now, that process can be very difficult for patients and their doctors to navigate. So this legislation would provide patients with access to basic information about the process, including providing patients with access to companies' policies about providing access to experimental drugs when it's appropriate. And then finally, the other big thing that this bill will do is it will provide new resources for the National Cancer Institute and the CDC to help develop models of care for pediatric cancer survivors. As I mentioned, we're expecting about 500,000 survivors of pediatric cancer by 2020 in just a few years, and we don't have a standard of care or very good models of care for these patients. So we need to make sure that we have those in place and that we start putting the infrastructure and the resources to match that in the coming years, and our bill would do just that. So we go to the next slide on co-sponsors. For those that can see this, there's a list of co-sponsors for this bill. We've got 36 co-sponsors listed. We actually just had one more added just a few moments ago, so we're actually now up to 37. We're making a big push this month, as I said, because it's Childhood Cancer Awareness Month, to try to get as many co-sponsors as we can for this legislation. So I hope you can take a look at this list, and for those of you who don't see your member of Congress on here, maybe you'll consider calling them up and urging them to co-sponsor this important bill. And if we could go to the last slide, please. I want to put a shameless plug in for an annual event that the Childhood Cancer Caucus hosts in September. We are going to be hosting the 6th Annual Childhood Cancer Summit this Friday here at the United States Capitol at 9 a.m. We're going to hear from some terrific speakers. Our keynote speaker will be Dr. Lee Hellman from the National Cancer Institute. We'll hear from other speakers as well, from the pharmaceutical industry, from the health provider community, from the advocacy community, and others. And one of the topics that we'll be discussing is actually the Childhood Cancer STAR Act. So we're hoping, as I said, to really educate people about this, but to really drive the policy as well. I provided Andy with a one-pager on the bill that includes a little more information that I didn't go over today, and hopefully that's something that can be shared with people listening on this call. With that, I hope people can be supportive of the bill, and if there are any questions, I'm happy to take them.
Great. Thank you so much, Andy. That was a great rundown of the bill. We will be posting that one sheet on RDLA rareadvocates.org website a little later today. If there are any questions for Andy right now, I'm opening up the line, so feel free to ask any questions onto the teleline. All right. All right. Seeing as there's no questions out on the line, must have been a very, very good explanation of the bill, Andy. Thank you for that, and thank you for your time this morning.
Well, thank you.
Great. All right, we will now move on to our next topic, ensuring access to clinical trials, the Eact, Senate Bill 139/HR209. So Stephanie Krenrich from the Cystic Fibrosis Foundation is with us on the call today. Stephanie, you can take it away.
Wonderful. Thank you, Andy. I appreciate it. And thank you, Julia, and everyone there for the opportunity for us to speak, or for me to speak today about the Ensuring Access to Clinical Trials Act. This bill is critically important, we think, to the rare disease community, and we've been pushing really hard for it to be passed in the House. So what I'm going to do is do a rundown of what the bill does, just as a recap. I think the last time I spoke at one of these lunches was in March, so a bunch has happened since then. So I'll do a quick recap of the bill and what it does, kind of a rundown of who our sponsors are and where it is in the process. Just some fast facts about the bill, and then I'll go through a status update, and then what you can do, if you're so inclined, to help pass Eact. So first, let me talk a little bit about what the bill does. So the Ensuring Access to Clinical Trials Act was introduced in January, and what this bill does is it simply removes a sunset provision from a law that was passed in 2010. Now, that original legislation that passed in 2010 and was signed into law was the Improving Access to Clinical Trials Act. And what that bill does is it allows those with rare diseases to participate in clinical trials and receive compensation for taking part in those clinical trials without that compensation counting against their income eligibility limits for SSI and Medicaid. It's a very simple bill, and at the time in 2010 when it passed by suspension in the House and under unanimous consent in the Senate. It had widespread support. And where it came from and where the idea came from is that we had been speaking with some of our colleagues in the rare disease community, and we were hearing through the Cystic Fibrosis Clinical Trials Network that folks were afraid to take part in clinical trials because they were afraid that they would lose their benefits. They were afraid they would lose access to Medicaid and SSI. And as you all know, as representatives of rare diseases are very expensive, and cystic fibrosis is no exception. And those with cystic fibrosis cannot afford to lose their health benefits. So we heard a lot of stories from folks who were afraid of losing benefits, some people who did lose their benefits. So we worked with some of our champions in Congress, and the Improving Access to Clinical Trials Act was passed, which was wonderful. The only thing is that there was a 5-year sunset. and the sunset is coming up. The sunset actually comes up on October 5th, 2015, so that's when this law expires. So all the Ensuring Access to Clinical Trials Act does is remove that sunset. It's a very simple bill, and we've got a lot of folks who are very in support of it, and I have to actually shout out to the National Organization for Rare Disorders and the Muscular Dystrophy Association, both of which have been wonderful advocates for this legislation, and I've been up on the Hill with them a lot pushing this bill. So if you wouldn't mind moving to the next slide. Great. So just so you know some information about the bill, we have about 76 organizations who signed a letter in support of the legislation, including NORD and MDA, BIO, Research America, and a whole bunch of others. I'm sure many of you in the room or on the call today have also your organization signed on, and we are deeply grateful for that support. Another good fact as we're advocating for this bill is that the CBO issued a preliminary score of this bill, and they found that it was minimal. It was all asterisks. So it'll cost less than $500,000 over 10 years, which is something that's very important to those on the Hill, and I think is a big selling point for this legislation. And right now, we are up to 49 co-sponsors in the House, and we had 15 co-sponsors in the Senate. So we're seeing widespread bipartisan support for this legislation. And I think as we go forward, I think it's really important to point out how important, I think many of you understand this better than anyone, how important clinical research is to the cystic fibrosis, or is to the rare disease community for those with cystic fibrosis and other diseases, how important clinical research is in finding treatments and cures, and any barrier that stands in the way of folks taking part in clinical research really is just too much. I mean, the rare disease populations are so small, and those who are recruiting for clinical trials for these rare disease populations face a real challenge in finding enough people to take part. So anything we can do to help remove a barrier to clinical trial participation, I think, is critical. Andy, if you would move to the next slide. So we have seen some great progress on Eact over the last few months. It passed the Senate on July 16th by unanimous consent, which was wonderful. And then this Friday, September 18th at 9 a.m., the Energy and Commerce's Health Subcommittee is having a hearing on issues important to Medicaid beneficiaries. So they're going to examine 4 bills that have to do with Medicaid, including the Ensuring Access to Clinical Trials Act. And one of our vice presidents, Dr. Mike Boyle, he's our vice president for therapeutics development, is going to be presenting at this hearing. He's going to be testifying at this hearing. So he'll talk about the importance of Eact, and hopefully it'll be a great discussion about why this legislation is so important. And then I think it's also important to point out that, as I said before, it expires on October 5th. So only 6 legislative days left until this bill expires, so we are down to the wire. I can say that we are hearing good things, and we know that leadership in the House is well aware of this legislation and of the upcoming deadline. So we are confident that, or we are cautiously optimistic that this legislation will pass prior to the expiration, but we're doing everything we can to make sure that those in Congress know how important this is to those with cystic fibrosis and other rare diseases. Which brings me to the last slide, which is how can you help? The reason that I was so excited about doing this call today is because it's great to be able to talk to so many members of the rare disease community and kind of give you guys information about ways that you can help if you're so inclined to help move this bill in Congress. So what would be most important is for you to reach out to your members and let folks know how important this is to your communities. One way you can do that is through an action alert that we have up on our website. And the link to that action alert is up on the slide right now, but it's basically, you can find it if you go to the Cystic Fibrosis Foundation website under Advocacy, and send an email to your representative through that about Eact, or you can contact me, and my contact information is on that slide as well. So if you'd like to get involved in our efforts, I'm more than happy to give you some information and kind of work with you on ways that your organization can be involved. I think my main point here today is just time is of the essence. We're down to the wire, and anything any of you can do to help move this bill would be greatly appreciated. And with that, I'm happy to answer any questions.
Great. Thank you, Stephanie, for all that great information. I will be unmuting all of the call-in users now, so if you have any questions, feel free to ask them into the line. All right, seeing as there's no questions, we will be moving on. Thank you very much, Stephanie, for that great presentation. This is a really, so thank you so much. Right now, we'll be moving on to our next presentation. And with us today is John Knapp from the Children's Hospital Association, and he will be talking about the ACE Kids First Act of 2015.
Thanks very much, Andy. I appreciate it, and thank you for giving me the opportunity to talk to all you folks on the phone today. I just really quickly wanted to provide an introduction to people about a piece of legislation, the Advancing Care for Exceptional Kids Act, or ACE Kids Act. These are bills that are active in the House and the Senate, and they're designed to help improve care for children with medical complexity in Medicaid. And I'm going to talk a little bit about what the aims of the bill are, the population that we're trying to serve with these bills, and the challenges they face, and then give a little bit of information on the status of the bill. So, Andy, if you want to go to the first slide. Okay, so as I said, ACE Kids Act is really an effort which the children's hospitals have been involved in to try and drive care improvement for children with medical complexity. And these are kids who have very serious medical conditions, usually involving 2 or more organ systems. And there's about 3 million of these kids nationally, we believe, and about 2 million of those in Medicaid based on the best data that we have. And these kids face a lot of challenges in their care. They require a lot of specialty care. They require a high degree of coordinated care if they're to get the most effective care that they can. There are a lot of challenges in just sort of even tracking the care of these kids, because Medicaid, as a national sort of a state-federal partnership, is 50 different types of programs. There's a lot of people saying in the Medicaid world, you've seen one Medicaid program, you've seen one Medicaid program. New York and California are very different. Florida, all these states are different. So really being able to say that you have a standard set of protocols or a standard set of data or anything applying in Medicaid can be very difficult. And with this population of kids, we're talking about a relatively small number of kids with relatively rare conditions in many cases, and very, high medical challenges, that there's really sort of a lack of consistency in their care and lack of consistency in the data surrounding their care. These kids are by and large getting care now, often through children's hospitals, which is what really got us involved, is that this is a population which we see a lot of, that we realize this is a place where we can try and advance the state of care, try and be proactive in coming up with solutions within Medicaid. So there's a few key goals behind this legislation. One is to try and improve the status of national sharing and standardization of care management models and practices, trying to learn from the examples of what's going on now already in providing care to these kids. And again, this is, again, with a focus on a coordinated care model, which is, again, nothing which is completely brand new in healthcare. The coordinated care model, medical homes, things like that are something that's been in place for a while. And we have seen children's hospitals that are doing this kind of effort with children's medical complexity. But we are trying to basically accelerate it to the next level, a little broader in scope, and try and put in some national standards and practices. Trying to address some of the difficulties that come with providing care across state lines, particularly in the Medicaid program, which for children with medical complexity is especially key because in pediatric medicine, the greatest shortages in terms of providers are of specialists. It's a little different from the adult world where I think there's a feeling that we have lots of specialists, we need more general practitioners. Within pediatrics, it's kind of the reverse. The number of general practitioners or general peds in absolute terms is not so bad, though they're not ideally distributed, but there's really big shortages in specialist care pretty much everywhere you go. And that causes kids who have medical complexities to need to travel a lot for their care. Even if you're in a big city on the East Coast or in California, it's very likely that if you have medical complexity, you will still need to go to more than one facility and possibly more than one state to get your care. And that can create challenges within Medicaid. And then the last piece is, as I referenced before, data. It's a relatively small number of kids who we're talking about, and within each state, the amount of kids is going to be of such a size that it's going to be hard to really extract a lot of meaningful information on their care, the cost of their care, the practice patterns for their care, which is why we feel that trying to create a framework that allows for national data would be really important to try and advance the state of their care. So those are some of the goals for the bill. How it would actually do this, thank you, is creating a framework that states could voluntarily opt into that would allow providers in the state to create nationally designated networks that could provide care to medically complex children. These are networks that would be anchored by a children's hospital, and the reason we believe that is because, A, these kids are receiving a great deal of their care at children's hospitals already. Children's hospitals have access to the networks of specialists and the infrastructure, the data collection, things like that, that would really allow them to provide the care in a coordinated manner. But the networks would extend well beyond children's hospitals. They would include a full range of providers that are needed to make sure that these kids are getting the right care in the right setting as they need it. We think that this model, which again is based on medical home models, which some hospitals have piloted within their states, really has potential to improve the continuity of care, improve the regional access to care because it would provide for networks that extend across state lines, and also, again, will provide a better means of collecting data, as one of the requirements of being a network is that you agree to collect and submit data. And again, just want to emphasize that top point. This is Medicaid, and so this is something which is not a mandate on the states. This is something which will be voluntary for the states. Medicaid does not work in a way where the federal government can say, states, you have to do this. It doesn't really work that way, certainly not since the ACA went into effect. So this would be creating a national framework where states under Medicaid could allow these networks to form. Providers, if they wanted to, could form these. It would be voluntary on the part of the providers and the families as well. If families didn't want to stay in networks, they would not be required to stay in networks. But we think the benefits of a coordinated care model would be one which would really help families, particularly facing some of the challenges that they have. This slide here, and I apologize for speaking so fast. I want to make sure I leave time for everybody else saying these, so we had a lot of folks on the agenda. This slide kind of is our attempt to illustrate some of the challenges that families of children with medical complexity face. The little girl who's in the center of this graph, Lillian, is a young girl who's now about 15 years old. That photo was taken shortly after she was born, who has a wide array of medical conditions. Her family lives in New Jersey, but they also get care in Philadelphia and Delaware on a regular basis, so they have to deal with multiple Medicaid programs. They show sort of all the range of care settings, insurance, social supports that they have to try and navigate. And it's a lot for a family to try and take on. And the idea here is that if we can have a network in place that can help coordinate that care, try and bring a little bit more structure to the interactions among the various providers, make sure that they're getting the care in the right place at the right time, that it can help sort of ensure, A, that you're getting less fragmented care, but also make life a bit better for the families and the patients as well. In the next slide here, again, just to sort of illustrate what I was talking about before about how pediatric care for medically complex kids is very regional in nature. This is a graph that we put together which shows the medically complex children that are served by Children's Hospital of Colorado and where those kids come from. And if you see an orange dot in the middle of Colorado, that's basically Denver. And that shows where the medically complex kids that they treat come from. You can see it's all over Colorado, but not only that, it's basically all over the Mountain West and extending as far as California and all the way to Georgia, Ohio. So this kind of illustrates the challenges that because of the nature of pediatric specialty care, you often have to travel great distances to get your care. And if there is a way that we can reduce the fragmentation, make it easier for the families that have to that this is their lives, basically, we think that that would have great benefits. We've been reaching out a lot to organizations that work with kids with medical complexity, and we've been happy that we've been able to generate a significant amount of support from such groups, groups like the American Academy of Pediatrics, the Family Voices, the Pediatric Congenital Heart Association, the Pediatric Department Chairs, nurse practitioners, or pediatric nurse practitioners. I think we all together have about 15 groups that have been supporting it. We are happy to talk with any groups on the phone or anybody at any time about the bill. We really do think that it represents a good model of care for kids. And again, this is one which is based in large part on sort of real-life experiences by children's hospitals that have set up their own, basically, demo projects on how you can provide care to medically complex kids in a coordinated manner and what the benefits of that are. I should, sorry, move on to the next slide. Oh, this slide actually has animation. You have to hit it again, sorry. And one more time. And one more time.
A lot of
this is not originally my slide, so I didn't realize how many animations.
There's a lot of champions.
He put a lot of animations in this. So this is supposed to show, like I said, we do have bills in the House and the Senate, and we have been able to get a lot of bipartisan support. We've been focused primarily on the Energy and Commerce and Finance committees, and in the House, our two lead sponsors have been Joe Barton of Texas and Kathy Castro of Florida, a Republican and a Democrat, both on the Health Subcommittee. And in the Senate, Senator Chuck Grassley of Iowa and Michael Bennett of Colorado have been our primary champions. The other folks on this page represent the original co-sponsors who joined with them when the bills were introduced back in January. A pretty broad geographic spread and very bipartisan. We've been very happy about that. And we continue to get a lot of support, and it's been very bipartisan as well. And so just to summarize where we are now, and actually this is slightly, it's been updated slightly. We're actually now up to 25 co-sponsors in the Senate, 13 Republicans and 12 Democrats. Lindsey Graham came on the bill yesterday, so that was our 13th Republican. And then in the House, we're actually up to 152 co-sponsors. We added Will Hurd of Texas, and we added one more person yesterday as well, another, Newhouse from Washington State. So we have two more Republicans on the bill, so we're up to 152. We would love to talk more with anybody on the bill who has additional questions, and we would love for people to, if they can, and they review it, they think that this is something they could support and ask members of their delegation to co-sponsor, we would love that. Like I said, right now the bill is referred to the Energy and Commerce Committee, referred to the Finance Committee. We don't have a timetable for action right now in the committees. We've been using, this is the first year the bill's introduced in their current form. There was a House bill for part of last year, but this is the first year we have bills in both the House and Senate. We've been really focusing on trying to build the support for these bills with the hope that we can get some committee action this year, possibly a hearing in either E&C and Finance, but we don't have a timetable for when that would happen yet. We just really hope that this will be something which folks on the line might take an interest in, and if you have any questions, you can always reach out to myself, Andy has my information, or you can go on the speaknowforkids.org website, which is an advocacy site which we at the Children's Hospital Association are very involved in, which has a lot of information about the bill and all sorts of issues impacting kids' health. So I want to thank Andy for giving me the chance to talk about this very quickly, I realize, sorry. But I'm happy to answer any more questions that people have about it.
And if you're on the line right now, the line is open, so feel free to ask your questions directly onto the phone line. Or if you want to use the chat function, that's also available on WebEx.
Not chatting.
Are there any questions out there for John? All right, John, thank you so much for that presentation.
Thank you, Andy.
And if you need any information on this bill, feel free to contact me, and I can put you in contact with John. Yeah, thank you very much. All right.
Apparently they're not controversial bills today.
No controversial bills. All right.
So everyone's holding their questions for you.
Right.
All right. Now on the line, joining us today is Annie Kennedy from Parent Project Muscular Dystrophy, who's going to be talking about the patient-focused impact assessment.
Hi, everybody. So
Nope.
No, you do it. Okay, I was going to try and be self-sufficient. So hi, everyone. I'm Annie Kennedy, and I'm talking about a bill that we introduced during the recess this summer, and right now we have about 40 organizations that have signed on in support of this bill, and we would welcome anyone else that would like to support this effort. And I'll just do a plug right now that we have template action alerts, one-pagers, lots of information that we're happy to send you. So if this is something that resonates with you and your community, please email me, and the last slide has my contact information. We're happy to provide it to you. So where this came from is many of us were involved with PDASIA and PDUFA, and out of that have done a lot of work in the patient-focused drug development space, or the science of patient input, and have developed a lot of tools to really foster and accelerate therapeutic development along the regulatory pipeline. So for our organization, we represent the Duchenne community. We've done a lot of work to really quantitate patient preferences around benefit risk. We have drafted guidance for the FDA, and the FDA has published their own draft guidance. We've done white papers called Putting Patients First. We have a PRO, and we have a lot of natural history data that we're now working to pull together. We've done a lot of work to make sure that both the patient and community and clinical experts have weighed in and gotten to know the FDA, and the FDA understands our community, and that those individuals would be present during an advisory committee meeting. And we are not alone. We know a lot of communities have done this. What we don't know, sorry, I won't touch the keyboard, is at the end of the day, we don't know how all of these things will be considered at the time of a product review. So how will all of this be used for the product review? Because that's really what it comes down to, is while we are hoping and we know that we're influencing the way that clinical trials are designed and how protocols are developed, which is very important to us, we also want to make sure that the patient voices are also impacting the review process. And that as reviewers are looking at data, they understand what an outcome measure means in terms of quality of life, and what a clinical outcome measure means to a family who's losing function. And so what we are seeking is a feedback loop from the FDA. And what we're looking for is the development of a simple checklist, a piece of paper, if you will, that the reviewers complete at the time of the product review that indicates whether or not the tools that were developed coming out of PFDD were in fact utilized during the time of the review. Yes, no, not applicable. I'm pausing to not touch the keyboard. So again, a feedback loop, and that those checklists, that checklist be published at the time of the review and then published in aggregate at the end of the year, and then we could then also look across divisions to know whether or not each division was utilizing those tools. Because while you may have, for example, in the Duchenne community, we've had terrific engagement at certain levels of the division, we don't know whether or not the tools that are being developed, so let's say benefit risk, are trickling down to reviewers. So in the case of a Duchenne review, if a reviewer were to check for benefit risk not applicable at the time of a review, we don't know whether or not the benefit risk data was not made available because the reviewers didn't know it existed. Maybe the sponsor chose not to submit it with their package, but it gives us pause, and it gives us an opportunity to then determine whether or not we're spinning our wheels, we're creating things that aren't valuable, but it's an important feedback loop to come back to the community, to go back to industry, to let us know whether or not what we are creating, the tools that we're creating, are actually useful at the end of the day. So that's simply what we're asking for. This is more information about the bill. You don't have to, this is my last slide, actually. Well, I have my email. So when we introduced it, it's called PFIA. These are initial sponsors, Wicker and Klobuchar, Senators Wicker and Klobuchar, Bennett, Senator Collins, Franken, and Isaacson. And we are seeking organizations to help support this. This is not specific to Duchenne. This is specific to any community that's interested. And we're happy to share information. And now we can go to the last slide. Nope. Maybe go to the first one with my email again. Okay, and there's my email address. It's annie@parentprojectmd.org. And if you would like information or to sign on or templates, I'm happy to send them.
Great. Thank you so much, Annie. It's a great presentation. The line is open for questions, and right now would be an appropriate time to ask them. If you have any questions on the line, please feel free to ask them to Annie directly.
So I just want to clarify for the community, there is language in the House side of CARES on patient-focused drug development, but it doesn't go far enough.
Oh, yeah, that's actually, thank you, Julia. So we were actually hoping originally that this would be a provision within 21st Century Cures. It did not actually make it as a standalone provision in 21st Century Cures, but we were told that our work around this influenced the PEFDD provision. We did not feel that it went far enough. Thank you, Julia. So what we decided was that we would introduce it as a standalone in the Senate, and we are actually now in the process of going back to the House side and introducing this in the House side as well. Okay. Thank you.
Any chance that the Senate Health Committee will strengthen the language, perhaps use the language in the Senate bill more accurately in their product they're developing?
That is one of our aims. We would like that very much. And we've actually they were the ones who actually suggested that we take this approach.
Excellent.
Do you have House co-sponsors lined up?
We are talking with a number of them who are interested.
Okay.
Yes. We're happy to talk to anybody, because there are a number of people have actually asked to be involved.
Are there any questions on the line? Okay. Seeing as there's none, I want to thank Annie for being with us today, and I will move on. All right. Right now we are joined by Michael Ilions from the Pediatric Hydrocephalus Foundation. He's here to talk to us about the Advancing Research for Hydrocephalus Act of 2015, HR 2313. Michael,
Thank you, Andy.
take it away.
Thank you. Thanks, Andy. Thanks, Julia, for the opportunity to talk about HR 2313. September is also National Hydrocephalus Awareness Month, and at the end of last month, at the end of August, we had our Advocacy Day on Capitol Hill and had about 150 family advocates representing 40 states have staffer meetings to discuss HR 2313 with them, as well as the Hydrocephalus Caucus, which Congressman Leonard Lance is a co-chair. He's my former congressman in New Jersey. If you don't know, hydrocephalus is basically a buildup of the cerebral spinal fluid trapped in the ventricles of the brain. There is no cure, and there is only a treatment option which requires brain surgery. It is the #1 reason for pediatric brain surgery. My own 10-year-old son, Cole, has had 13 brain surgeries to date, and obviously something more has to be done to deal with hydrocephalus, which is both congenital and acquired and can happen at any time in your life at any age. Former Congresswoman Gabrielle Giffords from Arizona has been shunted after her tragic shooting, and she also has hydrocephalus from that. We are having a briefing September 30th, a congressional briefing via the Congressional Pediatric and Adult Hydrocephalus Caucus, and this will be the top action item on that briefing day, HR 2313, which is pretty much the first ever standalone bill dealing with hydrocephalus. It was introduced in May by Congressman Chris Smith, also of New Jersey, and that pretty much came about after having a meeting with one of his constituent families who was involved in the PHF, the mom and her daughter Adrian, who is 23 years old and has had 65-plus brain surgeries, and that's right, you heard me, 65-plus brain surgeries in 23 years, and had a meeting with that family and invited members of the three-letter health organizations in attendance there to talk about what we can do, what they can do to better suit the hydrocephalus community, which is estimated that 1 million people in America have it, and it costs over $1 billion to treat a year. 1 in 500 newborns will have hydrocephalus as well. And out of this meeting came HR 2313, which basically will create a shunt registry, which is the only way we're going to get help with dealing with hydrocephalus on the research end, is to really be able to identify the amount of people that have hydrocephalus. To just about 20 years ago, hydrocephalus did not even have a category or a diagnosis code. It was listed on the brain other, so that was changed about 20 years ago. So if someone has another primary diagnosis, hydrocephalus is, again, not recorded. So we really need to have changed that coding system to help capture the amount of people dealing with hydrocephalus, and this bill will help. It'll keep track through the CDC, and will expand the infrastructure and activities to track hydrocephalus and incorporate that information obtained with activities into a national hydrocephalus surveillance system, which pretty much is a national database. to keep track of pretty much the only treatment option, which is the installation of a shunt, which fails. We are a medical device community, not a drug community, and that device has its own inherent issues with failure and, of course, any kind of infection traveling through the shunt tubing up to the brain will cause the shunt to have to be taken out, and then another surgery to take that out and put it back in eventually after the infection is cleared. So we are dealing with a lot of peripheral issues besides the hydrocephalus because of the amount of brain surgeries. And when we were at our advocacy day at Frank Pallone's office, Congressman Pallone, a 9-year-old boy was asked what his thoughts were about having hydrocephalus, and he said to pretty much everybody's surprise, including his own father, who didn't know he was thinking about this, was that when he goes to sleep at night, he's afraid he's not going to wake up the next day. Please help me and my friends. And that's what we're trying to do with this bill, HR 2313. So it's pretty much in its infancy. We don't have a lot of information because it was introduced in May, right around the time that everything was hamping up with the Cures Act. This was pretty much put aside, and Chris Smith tried to get an amendment put in that would add hydrocephalus to the Neurological Act that was a part of Cures, and no amendments were passed. So this was ratcheted up again at the end of the summer, and pretty much our advocacy day was the first public introduction on Capitol Hill about the bill. And I found out actually just an hour ago from Andy, after we put up my slide, that we now have a co-sponsor on the bill, Andre Carson from Indiana, who is Lance's co-chair on the Hydrocephalus Caucus. And that's pretty much what we have. Hopefully I'll get the opportunity to update everyone as we move forward and add some more co-sponsors and get some more support on the bill. And I thank you for your time.
Thank you very much for that presentation, Michael. I'm sure we all learned a lot about not just hydrocephalus, but also about the legislation, HR 2313. If you have any questions about HR 2313, please feel free to ask them on the line or email them to me or use the chat function on WebEx. So I'm opening up the line right now to any of you who have questions. Feel free to ask. All right, seeing as there's no questions on the line, we will move forward. If you have any questions in the future, please feel free to contact me, and I can hook you up with Michael Ilions from the National Director of Advocacy from the Pediatric Hydrocephalus Foundation. Thanks again for your presentation, Michael.
Thank you, Andy.
Yeah. All right. With me next on the call is the Executive Director of the Every Life Foundation, Julia Jenkins, and she will be talking about the hashtag Cures 2015 Day of Action.
Hi, everyone. Thanks, Andy. So I'm excited about this upcoming action alert, but the reason why we're doing it, I'm here to, we don't have a lot of great updates about the Senate's action for the Innovation for Healthier Americans, which is the companion bill to the House 21st Century Cures bill. So we are planning a day of action for everyone to call the Senate. I'm going to go through a little bit more, but it's going to be on Friday the 25th. We definitely would like all of you to participate. I know PPMD has already agreed to activate their advocates, and hopefully others can do as well, because we really need thousands of patients to call the Senate. So, oops, I just did the thing that Annie did. Okay, I won't touch the keyboard. All right, so 21st Century Cures background, all of you probably know this. We've been talking about it for every day. So in July, the House passed the 21st Century Cures Act, HR6, really going to dramatically improve rare disease research and treatments, but also all treatments for every American in need of a treatment. Unfortunately, now we have to go through the same process that we did in the House through the Senate, and then it needs to be signed by the White House to become law. The Senate's companion bill is, or it's not a bill yet, is the Innovation for Healthier Americans. And unfortunately, it is technically I don't know if it's officially stalled, but it's going so slow it feels like it's stalled. And we really need the rare disease community and all the patient community to speak up and make sure the bill is acted upon. So why the Senate delay? So to begin with, there's only 15 days in the session in September. First, they have to deal with an Iran nuclear deal. Next week, the Pope is visiting. They have to pass a budget or a CR by September 5th or September 30th, or the government will literally shut down. We are actually now heavily in the 2016 presidential election. And now the Health Committee even says that they're going to do education reform before they're doing the CARES bill. So this really says that the only way they're going to make CARES a priority is if the patient community stands up and makes their voices heard. And, really our motto for the switch sites is, a delay in legislation is a delay in treatments, and we cannot wait until after education reform, which hasn't even been started, is done through the Senate. So on Friday, September 25th, we'll actually have about 500 rare disease patient organizations in the room and on a webinar at the Global Genes Patient Advocacy Summit out in California. And in the morning, we will be asking all of those advocates to call the Senate, tweet the Senate, Facebook the Senate, between the hours of 11 and 1 Eastern, or I think that's like 8 and 10 Pacific time, to urge the Senate to take action. And the reason that we've picked a specific day and a specific time is to really make an impact. You want to shut down the Senate phone lines. And this is a tactic that's been used by advocacy organizations for years. But if you can make a Senate staffer's life miserable by having nonstop calls to their office, you really can make an impact. Now, obviously, if you can't make the call at that exact hour of the day, we still want you to call and tweet and Facebook all day long. So we will have a sample script for all of you. We are, again, this is in 2 weeks, so, or actually it's the end of next week, but anything could change. We are expecting the Senate to release a draft sometime in October, but that's just a draft. That's not even real legislation. And if it takes the same with the House, it's draft 1, draft 2, draft 3, maybe legislation, then it has to pass the committee and it has to go through the floor. So this is a lot of time, and if we don't tell the Senate that this is a priority, it's not going to happen. And that's not a veiled threat, that's a reality. And we've worked so hard to get it to move through the House. We have to mobilize to get it through the Senate. So if you think about the 30 million Americans, if we could mobilize just not just 1 point, but that's only 3.
No, it's right. The math there is right.
The math is right? All right. we could just mobilize 30,000 advocates, which is nothing. We should be mobilizing quite a bit more than that. But we could have an enormous impact. We have 30,000 calls to the Senate. That would shut down the Senate phone lines. And that's not a huge ask of our community with, 30 million Americans. And that's just patients. So we're encouraging parents and families and caregivers. We need to all unite on this day. And industry, don't forget about our partners in industry. They could definitely call in and have an impact as well. So, watch out for our email blasts. They'll be coming from the Every Life Foundation. We'll be emailing out to our entire database. Global Genes will be doing posts on social media. We'll have hashtags and all that fun stuff that we'll actually be able to see your hashtags at the Global Genes Conference. So when people are calling their senators, they can put in the hash. It'll be pretty exciting for everyone. Again, sample scripts and phone numbers. The link right now is live, the bit.ly CARES Now. You can see sample scripts. All you have to do is put in your contact information with your zip code. It'll pop up the sample script and your senator's phone numbers. So very easy, but we also have a big list of all the senators' phone numbers and Twitter handles that you can download and you can use to activate your communities. We do ask that you share this with all your networks. It's really important that you just don't do this on social media. You need to make a direct ask of your community. So sending out email blasts to your organization's contacts is really essential in this, because the percentage of people who actually take action is about 2%. So you really have to activate quite a bit more of your community. So, we really hope that everyone will unite together. And the best part is, if you're on, say, my database and Parent Project Muscular Dystrophy database and a few others, if advocates see it multiple times, they're more likely to take action because they feel the momentum. And that's really what we're trying to do. Oh, this is September 26th. That's the typo. September 25th is the day of action. It's Friday. Don't call us in on Saturday. They won't answer. But, you know, the reason why we're targeting this date Friday, you know, the government deadline for shutdown is a few days after this. But we really are hoping that this might spur the Senate to move up the timeline for issuing their first draft of the bill, and then we're going to have to keep on the Senate. This is one of many action alerts. We're going to need to make sure that the bill passes, and there is some momentum. Bills are being introduced in the Senate, but we just really need to make sure that they can move them in time, because if we make it through the end of next year, it's going to be crazy election season, and I don't think that anything will really pass, and then Congress is over and we have to start all over again, and no one wants to do that. So really, make treatments a priority. I urge you and encourage you all to participate and hope that you will.
Great. Thank you so much, Julia. If you have any questions about the action alert, you can email me directly, use the chat function, and the line is open right now if you want to ask any questions. All right. All right, now I'm going to be giving some updates for RDLA and some advocacy updates for events going on in our community. Next month, we'll be hosting a Senate briefing for the Innovation for Healthier Americans. Now, this is monumental for us, for RDLA, because it'll be our first Senate briefing, and that is in Dirksen, room 106 on October 8th at noon. So if you want to take down that information, we'd love for you to be there. It's October 8th at noon in Dirksen 106. We will be highlighting the legislative priorities of the rare disease community for their inclusion in the Innovation for Healthier Americans. This, we hope, will come at just the right time when the Senate draft comes out in October. So please pay attention for that, and we'd love to see you there.
So we did actually do a nearly identical briefing in the House, and most of the priorities that were discussed in the House bill, or the House briefing, were included in the final version. So we're hopeful to do this again. But again, we've got to keep on the Senate. So you'll be getting an actual on this as well to make sure that senators actually send staff to the briefing. So Andy, I just got an email that the unmute function is not working, and that people are submitting comments and we're not seeing them.
Okay.
So sorry about that. We did get your messages, but we'll try to unmute you so we can get your questions and check out the chat feature. But everyone here is still in the room and I think on the line, so we can still answer questions throughout.
Yeah, Julia, there's a question from Eric that just came up. Eric Grinstad asks, is there anything controversial on the Cures Act that is causing the Senate's delay?
I mean, I don't think there's a huge amount of controversy in the Senate other than the fact that the Senate was literally created to move very slowly.
And they only seem to be able to do one thing at a time.
Right.
They can't multitask.
So, in the House, we had, Chairman Upton, who, this is his legacy bill. The time for him to pass a piece of legislation was this session. The chair in the House, or on the Senate side, doesn't have that deadline looming over him, so he has all the time in the world, and it's unfortunately not a priority for him. I think he does think it's important, but unless he hears from the patient community, they're not going to make it important. They're not going to make it a priority. The chairman does, education reform is a huge priority for him personally, and it's really all about the individual chairman's personal priorities. So, it's if we want this, we have to make a statement that we want this, and we have to be united in that. And I think, unfortunately, everyone has come to the, realization that, oh, well, if it doesn't happen now, we'll just wait for PDUFA, which happens in 2017. It's a must-pass bill. But as patients, the disease is going to progress in those 2 years. We cannot wait for the legislation to be passed in 2017. It's unacceptable. We're so close. Just pass the bill now. We can add more things in PDUFA later. But I think that as far as controversy, I don't think, you know, a lot of the controversy, there's some pay-for issues, but I think there's nothing that is so crazy about the bill. That the FDA spoke, I think was it 2 days ago or yesterday, again, and reiterated that they are 100% fine with the language in the bill. They have no concerns over safety. They are comfortable with all the provisions. You know, let's get it done.
An issue of prioritization.
It's absolutely an issue of prioritization. And again, this is a democracy, so if you want it done, you have to speak up and make sure it's done.
Great. I think I've gone.
Can I step back for a second? Julia, you said for the 25th you were going to be sending out a template for the call.
Yes.
Can you tell us when we should anticipate receiving?
So you'll probably get it early next week. We're just waiting. We had home use today. We're waiting to see what happens.
Okay.
We always hope that maybe some miracle will happen and they'll release the draft like this week, and then we can applaud the Senate for their action instead of shaming the Senate for non-action. So we didn't want to send out anything too early in case something by miracle did happen. But we know, I mean, once early next week happens, the Pope's coming to town, and then basically D.C. is shutting down, and it's all about the Pope.
And you don't think he'll bring a miracle?
That was good. That was good. It would take a miracle. I did not see cures on the agenda, but yeah.
All right.
Yeah. Any other questions?
Any other questions on the line? I believe everybody's unmuted now.
Dr. Eckstein, can you hear us? Can you get through?
I can hear you. Can you hear me?
We can. Do you have a question?
Well, this was back from the Children's Hospital issue, and
yes.
I was just going to mention that, or suggest that perhaps in addition to care, diagnosis might be emphasized. It appeared on, I think it was slide 15 as one of the bigger bubbles, but it's certainly in these complex pediatric cases a significant problem. About half the cases that come into the undiagnosed diseases program were pediatric cases, and now that it's launched, and today the UDN launched the patient portal, I think it would be good to emphasize diagnostics as well as care.
Thank you very much for that comment. That's something to take a look at. I appreciate that.
Anyone else who had tried to speak up earlier and was not able to? The lines are unmuted now, and hopefully we can.
Yes.
All right.
So. Well, Andy Russell here on the line from RDLA, and I want to give you guys a few updates about what's going on with RDLA and the kind of events we're throwing. Like I said, we have a Senate briefing coming up on October 8th at noon in Dirksen. And I want to go over just an event that concluded earlier this month. It was our in-district lobby days, and this is when the House and the Senate go home for summer recess, and we send advocates to their office to discuss rare disease issues. This summer initiative was wildly successful, and it was aimed at building relationships between the rare disease community and their members of Congress. And just some of the numbers on, as you can see some of the pictures from the meetings, we had over 140 advocates attend over 145 meetings. So most advocates went to 1 or 2 meetings, and these advocates were wildly successful in getting their member of Congress to agree to sign on and co-sponsor legislation. We had new members join the Rare Disease Caucus, and we had senators agree to support the Innovation for Healthier Americans once it's introduced. So I just want to thank everybody out there on the line who participated in in-district lobby days and sent me feedback and pictures. It's all very helpful for for me moving forward with the event. So if you participated and have not yet written a little summary of the meeting and sent me some pictures, feel free to do that. Also feel free to thank your member by sending him a letter or an email or her for meeting with you to discuss rare disease legislation. Right here is the map. Each star represents one meeting that we had in district. So we had a pretty good coverage across the United States. Now, there are some states that we were not able to find advocates in, or that advocates couldn't make it to their meetings. So if you see any states here that are uncovered and you may know some rare disease advocates that would like to be involved, or you yourself would like to be involved, feel free to send me an email and contact me, and we can get you on the next mailing list, and hopefully we can get you into a meeting with your senator or Congress member. So be on the lookout for during next summer recess to participate in district lobby days. All right. On November 4th, 2015, we will be having our Rare Voice Awards Gala. This is at Arena Stage in Washington, D.C. 2015 will mark the 4th year of the Rare Voice Awards, and this year's awards will focus on the compliments coming out of 21st Century Cures, and we'll be honoring Representatives Upton, DeGette, and staff from the Energy and Commerce Committee. So it looks to be a great night. If you haven't come, I really urge you to come this year. It's going to be great. It's free and open to the public. And we do that to encourage staff from the Capitol to come and meet the advocates and do some networking. So again, that's November 4th, 2015 at Arena Stage in Washington, D.C. And lastly, our next meeting will take place on October 14th, 2015. If you have any agenda items that you would like to present on, please send me an email at arussell@everylifefoundation.org, and I can try to get you on the next call. Right now, I will open up the phone lines, and if anybody has any outstanding questions or comments, feel free to speak on the line right now. We are open. And I just want to thank everybody for coming to the call today, for logging on and dialing in. We went over a lot of great bills. If you have any comments or questions that come to you later on in the day or tomorrow, feel free to send me an email. All right. Are there any questions on the line?
I have a comment.
Yeah.
Hi, my name is Grace Lowe, and I'm in South Florida. And one of the things that I believe that is delaying our Senate is because as advocates, we don't go out and speak to our people, our citizens, and educate the public about rare diseases and how rare diseases are affecting us. I believe my movement will be between today and the 25th to go and visit all our local town hall meetings and invite them to call our Senate on the 25th.
I think that's a great idea, and really using your social media tools to promote awareness. But obviously, if you can connect with local elected officials and have them call the Senate, they actually have better connections and can get through. And I think that's a great point, that we definitely need to start locally, build local awareness with our local public officials at both the city council, at the state level, you know, and really activating all of your contacts, whether or not they're affected by rare disease. You know, a good talking point we always say is, well, if you care about jobs and innovation, you should care about rare disease treatments, because or building science. It just affects so many different things. You know, someone's going to care about it for some reason, but it's always the patient stories that have the best impact.
Absolutely. When I went to the meeting with our Senator Bill Nelson, I was surprised. I was actually shocked that they told me that they never heard anyone from South Florida coming to their office and speak about anything to do with rare diseases. And he asked me, what would it be that moved me to this? And I say, I have no choice. My only child is being affected by a rare disease. And as a single parent, I have to take it upon myself. I created a small foundation to create awareness and educate our public and our communities about how rare diseases are affecting 30 million Americans.
Yeah.
Absolutely.
That's a great example of being an amazing advocate and going, you know, the extra mile for your kid or for the rare disease community. So we appreciate that, and if you want to get more involved and, you know, come to DC, we'd love to help you get there and help you get in contact with your senator or congressman or woman.
So one of our big, you know, our gala is a big fundraiser for Rare Disease Week on Capitol Hill, where we bring, and we had all these meetings in district, but we really encourage everyone to join us in Washington, D.C. for Rare Disease Week on Capitol Hill. And we have scholarships available to help advocates come, and we'll be getting that save the date and travel scholarship application out in the next month or so. So we're excited about that. It's going to be David from the NIH is on the line. We partner with them, and they're going to be kicking off Rare Disease Week at the NIH this year.
On Monday. On
Monday, which is actually Rare Disease Day. The 29th. So we're excited about that and excited again to partner with the NIH and having our reception following that and legislative conference and lobby day and full week on Capitol Hill. So, you know, our gala is a big fundraiser for that, and we hope that everyone will come out and support. Any other questions?
We have I'm sorry. We have on the Rare Disease Day, for the second year, we have our awareness walk. And what we do, we go to different schools educating our children and have them come to walk with us on this day. The state senator, when they came with us, and different cities from the state of Florida joined us this year.
That's fantastic. And we actually, you know, Florida is the members in Florida are very supportive of rare diseases. Kathy Castor's been mentioned as the co-sponsor of these bills, and Representative Zalarakis. So the Florida advocates are really doing a great job at activating their members. That's New Jersey as well. We have a lot of great support from New Jersey. So any other comments on the line? We've gone well over our hour meeting time. But there's so many bills. It's pretty exciting. How many pieces of legislation there are out there that affect rare disease patients. And there's actually been more that were introduced yesterday that we'll be talking about on the next call. So really excited to keep you all updated, and hope you will take action on the 25th.
Could you just tell us what the week?
What?
I'm sorry, can you just give me a week of the Rare Disease Week?
Yeah, Rare Disease Week starts on February 29th and goes to March 4th. February 29th to March 4th is Rare Disease Week. All right. Any other questions out on the line? Well, I just want to thank everybody for calling in and logging on today. We had a great call. Thank you to our speakers. Thank you to everybody who came in person today.
Take a sandwich.
And I look forward to hearing from all of you guys and advocates on the next call. So thank you very much. You know, hear from you next month.
Thank you. Have a great day, everyone.